Can previous trauma affect postpartum depression? Have you ever wondered how past experiences shape our present feelings, especially during significant life changes like becoming a parent? The connection between previous trauma and postpartum depression is an important topic to consider. Yes, previous trauma, particularly trauma experienced during childhood, can increase the risk of developing postpartum depression. Women who have faced trauma earlier in life may find themselves more vulnerable to depression during pregnancy and after childbirth. This increased vulnerability often relates to how trauma affects emotional regulation and stress response. When a woman has experienced trauma, it can influence her coping mechanisms during the challenges of the postpartum period. For instance, she may struggle with negative automatic thoughts or unhelpful beliefs that can intensify feelings of sadness and anxiety. From the perspective of cognitive therapy, postpartum depression involves negative thoughts and behaviors that contribute to depressive symptoms. Previous trauma can create persistent negative beliefs about oneself and the world. A woman with a history of trauma might feel heightened vulnerability or low self-worth, which can amplify feelings of overwhelm after giving birth. Cognitive behavioral therapy, often referred to as CBT, is a helpful approach for addressing postpartum depression. It focuses on identifying and challenging negative thoughts and core beliefs. For women with a history of trauma, CBT can be tailored to address those trauma-related thoughts and teach coping strategies for managing distressing memories or emotions. Research indicates that psychotherapeutic interventions, including CBT, are beneficial for women with postpartum depression who have experienced trauma. While CBT targets cognitive and behavioral aspects of depression, interpersonal psychotherapy may also be effective for this group. CBT helps women develop balanced thinking and healthier behaviors, which can reduce depressive symptoms and improve overall functioning. In practical terms, cognitive therapy for postpartum depression in women with a trauma history might involve several strategies. These include identifying trauma-related negative beliefs that impact mood and parenting confidence. It also teaches skills to recognize and modify automatic negative thoughts. Encouraging engagement in enjoyable activities can help lift mood, while developing problem-solving and stress management techniques is essential. Additionally, enhancing communication and support-seeking behaviors can be beneficial, sometimes involving partners or family members. If appropriate, gradual exposure to trauma-related memories or feelings can be included, always at a pace that feels safe for the individual. Overall, previous trauma can significantly affect postpartum depression by influencing cognitive and emotional processes. Tailoring cognitive behavioral therapy to address trauma-related issues can lead to better treatment outcomes for postpartum depression in women with such histories. Understanding this connection is vital for effective support and healing during the postpartum period.